Also, want to point your attention to a little handout that is included in this week's webinar. If you're watching after the live episode, that handout will be on our website behind our client section or our client portal. Now, that doesn't mean you owe us anything, but we try to keep some of our materials a little bit back, not off of the main public facing websites. You actually have to log in. But this resource, if you're watching online after the fact and you happen to be interested in it, then then that's where it will be. Oh, James is sort of with us. He's at LAX waiting on a plane to go to Florida. James got some exciting news. I won't I won't jump the shark or tell you beforehand, but he's going on a cruise, and so I'll just stop there. But have fun. You're going to be in a much better place than I am, and I'm jealous of you. So, but James is at LAX waiting to go on a cruise, so that's cool. Got somebody from Alabama. All right. Oh, it's 2:02. I'm late, so I'm probably already losing people. But thanks for being here. This is episode number 27 or 28 of our webinar slash podcast series, The Evidence Show, where we talk about all things evidence. So we got one thing really to talk about today that I think is important. And cool thing is, it came from a class, and I think it was Stacy Miller, and I'm not sure where the class was. And I hope if you're not watching, I hope it's okay that I use your name. Let me look through. Let's see. Well, she's not on, so don't tell her. Uh, but she had a question about drug take back programs. And if you've been to one of my classes or if you've been to any of the training stuff that we do online, I will just tell you my position from the outset. Not a big fan, not a huge fan. And that's what we're going to dedicate this class to. But Stacy's question was, all right, so you say they're a bad idea. Why? And if they are a bad idea, how can I convince my agency to change? And that really got into a lot of my favorite things. One, building a case for eliminating drug take back programs. But two, how do I get my agency to change? Because really, as evidence custodians, there is a high degree of likelihood that that drug take back programs aren't the most awesome thing for you to spend your time on. It can be a tremendous drain on personnel resources, on time and space, just the laws of physics. There are a lot of compelling reasons not to participate in drug take back programs. It's quite another thing to get your agency on board with shutting down one of these programs. So that's what we're about today, and we'll talk about those things. And it is 2:04, so now we're going to be in earnest. So if you join us late, take the little file at the bottom of your screen there. It's Take Back the Take Back. And what that is, I'll just bury the lead. That's a resource for you to use just to start building your own case at your agency for eliminating drug take back programs. We're going to build a case today on our program that is general, but at your agency, it's going to become very specific. So before we do all that, I should have really kind of flip flop things around. Let's do the intros first. Couple of cool things. I'm horrible at Facebook. Uh, I've said that many times. James is awesome at it. And by awesome, I guess means he checks it and pays attention. I try, but I use Facebook Marketplace a lot. I just bought a drill press and I'm selling a fly vise, but I need to be more diligent about checking the community forum because I really do truly believe it's a great resource for those of you who use social media. But one cool thing is we just eclipsed 1,000 people participating on that forum, and 1,000 people. If you look at the population of the world, like 7.5 billion, 1,000 people ain't that big. But I think it's cool that 1,000 evidence custodians or people that work specifically in the area of evidence management have a place to land and talk about evidence related things. And I also think it's cool that there are other organizations that are taking a cue and trying to build community spaces as well. I don't think you can belong to enough of these, honestly, because you're going to hit different audiences, there are going to be different perspectives. We really appreciate if you've joined the Evidence Management Community Forum on Facebook. continue to support that and ask questions. And more importantly, if you got answers, check it to see if there are people out there that need your help. Um, that's really the huge benefit. There are a lot of evidence custodians across the country, and I've been to a lot of training classes this year, met a lot of fantastic people with an incredible wealth of knowledge. And those are the folks that we want on these forums contributing and adding their wisdom and their collective knowledge to the fold. That's what makes these things better. That's what makes these things work. So do that. We just went over 1,000 people, and we hope to make that grow. But I think it's cool. So we're gonna move. I'm having some technical difficulties here, if you can't tell. Another thing I want to point you to is Tracker Products. They keep the lights on here, and we've we've been in a partnership with them for a long time, and I am deeply appreciative. And what would help make that continue to work is if you go to their website and get yourself some software. So visit them at trackerproducts.com. They're an evidence management system, and they can help automate your agency and move you into the uh, was it 22nd? No, 21st century. Let's just stop there at 21st century. So go visit them at trackerproducts.com. They've also sponsored, they've been our primary sponsor for our training classes that we do or that we've done this year. We'll talk about those in a second, but I'm grateful for that partnership uh, and think you should check them out. So that being said, let's move on to the next thing. Oh, that's our website. So if you want to find out more about what we do, like our training classes or consulting work or any of the stuff that we do, that's the place to find it, evidencemanagement.com. And on that website, you can find lots of things that I hope you can use as an evidence custodian and translate that into useful, meaningful tools to help you change the culture at your agency and change the state of evidence management at your own little corner of the world so that we can begin changing it all the way around. So, those are the little plugs at the beginning. Now, on with the show. This is episode number 27, season three. I, that's probably not accurate, but it sounds good. And today we're going to talk about tag. You're not it. No takebacks. Now, those are things that you will hear children say when they're playing tag or when they are arguing amongst one another. I haven't heard that in quite some time from my own children because they're almost grown. But for us, no takebacks is something that I would love to see more and more and more happening across the law enforcement world with respect to drug takeback programs. So today's episode is dedicated or devoted to building a case for taking back law enforcement drug takeback programs. Now, if you're a huge supporter of those programs and you think they're the greatest thing since sliced bread, please stay tuned. I would love to hear from all perspectives. And if you've got a case why this is a horrible idea, I would love to have a conversation with you. I am open to having my mind changed on just about everything, but I really feel like these programs do more harm than good, and they don't help us uh, advance our core mission, which is taking care of evidence. So I'll build a case, you build yours. Let's have a conversation. We can talk about it, but before we do that, let's talk about some other stuff. I don't know why that slide is there. I just leave it in there. What are we talking about? Obviously, what I just told you we were talking about in the last slide. And we'll talk a little bit about next time on the evidence show. There is a date change for next month's episode. I will be in Cozumel on a beach on the day we were supposed to do the original one. And I am not going to be here on that day. So we're going to move that to November 10th. Um, but I want to talk about stuff we have coming forward in 2023 because 2022 has been a good year. I mean, it's been nice to get out of the pandemic and to finally have a place to go. And let me see if that screen is up there. Oh, is that paused? Let me look. Can you not see? All right, we got volume issues, and your slideshow is not. Oh, there we go. Dadgummit. Technical difficulties. Let me see what I can go resolve. So we had one issue with volume. Test, test, check. Is that any better? Is that any better? You got to help me out there. All right, I'm going to assume that that's better. Hopefully it is. The slideshow isn't changing from the Facebook group ad. All right. So hopefully we've resolved both of those. You didn't miss much. What I did, let's just go backwards. Yeah, there's the page that you hopefully saw. This is Tracker Products page, trackerproducts.com. That's mine. And that was the title. And this was a completely unnecessary slide that we were just on. So I think we're in a good spot. Hopefully, Dennis, you can hear me. Oh, let's see. Volume is, James says the volume is great. Susie says not really. Dana can hear me just fine. When I'm at the mic, Dennis can hear me. No slideshow issues. Okay, wow. All right. So I turned the volume up. Let's see if that works. Um, and I'll try to speak into the mic. Still learning these things after 3 years. Okay. So all that was kind of weird, waste of time, but hopefully now you can hear me. One of the things that you might not have heard at the beginning was I wanted to direct you to uh, the little handout section. There is a PDF there. It's about 7 pages, which specifically addresses all the things that we're talking about in the webinar today related to drug take back programs. And again, we won't reiterate everything, but hopefully moving forward, everybody can hear me and we'll just kind of go from there. So I'm glad that at least the volume is up now and that you can hear me and we can talk about 2023. 2022 is drawing to a close. We did a lot of training classes this year and it was a lot of fun, met a lot of good people all across the country and very excited to be doing live human to human training again. Um, it was great and got out to an association conference or two this year, missed a couple of others, but I want to talk about 2023 and just different places it will be. We're going to go to the Cape Conference in April. That's early part of April. So if you're in California and you're a member of Cape, please sign up for that. Fill it up because we would love to see you there in the first part of April of 2023. The PEEF conference is in May of 2023, and we will be there again, hopefully. Uh, I think we got invited back, so we'd love to do that again. And we're talking with some folks in New Mexico at NIMPIT to work with them and help them at their training conference. I think that'd be fun. Always love going to New Mexico and working with the folks at that organization. They've been around with us for a long time, and they're great folks to work with. And we hope to see them in September. But all that being said, um, we love to support property and evidence associations. Wherever you are, we want to be a participant. We're working on building more collaborations with different organizations and just being whatever we can be to help out wherever there is a need. And we feel strongly about that. There is probably no better resource at any state level for evidence custodians than a state or regional property and evidence association. There's just not. Um, so we'll talk more about that in just a second. That being said, we're going to do some more training in 2023. Our full schedule will be out in November. Hopefully, November 10th, we'll have things finalized. It's difficult to finalize these schedules. There are a lot of moving parts, and you got to find people that are willing to have you come out. And we try to do things in a very specific way. My first preference, if there is a state association in an area, I want to partner with them. And I want to make sure that I'm not conflicting with anything that they're offering their members or conflicting with a state conference or business that they're trying to do. We don't want to, we want to pull in the same direction. So coordinating with those organizations where they exist is one thing. Starting them where they don't is another thing. But we will definitely be doing live training again in 2023. We're going to hit more places in 2023 than we did in 2022 because we changed our business model. We changed it to more industry sponsored. So our classes for next year, just like in 2022, everything is covered. Your agency does not pay to send you to class other than room and board if you're out of town. But that covers the training, that covers the materials, uh, that covers certification, that covers everything at no cost to your agency. Now, we don't pay for travel and we don't pay for hotel, but we will feed you the whole time you're there, at least during class. And we think it's a good deal. And we think it's something that we've seen benefit a lot of different areas and a lot of different regions. And we hope to continue that as long as humanly possible. It just makes a lot of sense. The thought behind it was evidence custodians and police departments, they typically aren't able to send or choose not to send evidence custodians to training, for whatever reason. Companies that make products that are specifically intended for evidence management and evidence operations for law enforcement, they have a vested interest in getting in front of people that need their products. So we eliminated the whole can't pay to send you to training, and we created an environment where people that sell things to evidence management units, they all come together, everybody's happy. And we're working on expanding that. We're working with some new vendors in 2023 that we're hopefully going to be able to bring on board so we can do more of this training and not less. So all that being said, that's the goal. Now here these are the places. In 2023, we've already established some target locations. The only one that's completely firmed up is Palm Springs, California. We'll be there in February 2023. So that one is completely firmed up. There might be a couple of dates, but these are the areas where we're working on establishing training classes for 2023. We want to hit the Denver, Colorado area or the north of Denver, Colorado area. That would be great. Um, we'd love to do that in the summertime, uh, just for fishing. Fort Wayne, Indiana. We're working with that agency to bring training to the Midwest into the Indiana area. Love to go back to Missouri and help partner with MAPE. I don't know if there are any of you online paying attention, but we've sent some emails. But would love to do a training class in Kansas City, Missouri, and maybe help the Missouri Association for Property and Evidence find some more members and get some more people involved in the process. We'd love to do that. And we'd love to go back to the Minneapolis, Minnesota area, especially during the summer because it's beautiful there. And we haven't been back in a while. We were in Maple Grove a few years ago, and we just want to go back to Minneapolis, that area, uh, because that's where Prince is from. So maybe he was St. Paul, but we like that area. And Minnesota has a reestablished evidence association that if you're in the state of Minnesota, that it would behoove and benefit you to take part in and join immediately. Um, we also want to hit the Florida area, preferably on the Gulf Coast, working with an agency there, trying to get them to say, yeah, come on out. Same thing in the Oklahoma City, Oklahoma area, possibly. And I know, Dana, you probably haven't got an email, but we'd love to go back to Maryland, either Baltimore or Frederick, anywhere in Maryland, not in Texas. And the last time we did a class in Frederick, I brought with me 98-degree weather the whole time. So I will promise to leave that back. Doesn't have to be in Frederick proper, but just somewhere in Maryland. We want to be in that general northeastern seaboard somewhere. Same thing with northern New Jersey. We'd love to go to New Jersey. Uh, truly, I mean, seriously, we do. That's a region that we've never been to before, and we want to do some training there. So we definitely want to hit that northeastern area. We don't get out to the northeast as much as we do the west coast, so we're trying to change that. And that would give us like 10 classes or 9 classes technically. We would love to do one more. We still haven't kind of established or decided a place for that. We're thinking Fiji or Cozumel. Um, any area where there's a river to go fly fishing or a beach would be ideal, but we will also go to other parts of the country that don't have either of those. So that being said, next month at the show, we will announce everything that we've got solidified for 2023, and we will open the registration process up so that you can make plans to attend in advance. We'd love to have you there, but we'll stop talking. So here's the question. This is hypothetical. You, as an evidence custodian working at your agency, would you allow an officer to submit a huge package stuffed with drugs and pounds of just undocumented trash and just leave it in the lobby for a few months and then someday expect you to go pick it up? Would you do that? And I should have made this into a little poll, but I'm just curious. Would anybody do that? And if you would just type in the little question window, yes, that sounds like a great idea. Because to me, essentially, that is an oversimplified version of a drug take back program. Got a huge box out in the lobby. Typically, it's left for months and months and months until it fills up. We have no idea what's going in it. We really don't know who put it there. We don't know what's in it. We think probably drugs because that's what we asked them to put in it. But it's usually not just drugs, it's usually just a big pile of garbage, some of it drugs. And then we go pick it up and we store it. Now, for those of you that are proponents and fans of drug take back programs, that's going to seem like probably a fairly unfair assessment of what a drug take back program is. But that's not the question. The question is, would you allow an officer to submit a big bag of drugs, not really labeling them, have no idea what kind of drugs they are, just going to put them all into a big pile, stuff it in a box, and then we're going to leave it in the lobby for a couple months? I think I already know what the answer to that question is. The answer is no. You wouldn't do that. Nobody, even without training, having never been to a class ever, would think that that's a good idea. There are certain things that just sound like bad ideas because they are bad ideas. But that being said, that's what we do with drug take back programs. Now, there are ways to do them better. There are ways to safeguard and to take some of these elements out of the equation. But in general, that's what a drug take back program is: a big bag of garbage. We have no idea what it is, we have no idea where it came from. It's just our job to go pick it up. So, since the answer to that question is no, and if the answer to that question is yes, I've said this many times before, if the answer to that question is yes for you and your agency, then you should be fired because that's a bad, bad thing to do. That violates literally every principle that we teach in class, that we see just from any training class anywhere. Just a bad idea. So, that being said, let's start building a case. And I think when we build a case for taking back law enforcement drug take back programs, there are a few things that we need to look at. And again, this for me has been a soapbox issue for years. But I got a question in one of our classes. All right, buddy. You think it's a bad idea? Well, how do I sell this to my agency? And that made me start thinking, how do we start dismantling these programs, and how do we start changing minds and changing the focus away from these programs and and create solutions to problems? That's what we're about. So we got to do a few things, and we'll do a few things here just as we go. The first thing we got to do, and this applies to a lot of different aspects and elements of what we do. First, we got to challenge the way we've always done it. And if you've watched this show for any length of time, or if you've ever met me, one of the things that perturbs me the most in the world is using, well, that's the way we've always done it, as a reason, a good reason for doing anything. The way we've always done it has been a justification in law enforcement for a lot of terrible things across a lot of different areas for a long, long time. And it's time that we stop relying on the way we've always done it to excuse or to justify anything that we do. The way we've always done it, inherently, by definition, is in the past. Some of the things that we've done in the past are great, but a lot of things that we've done in the past don't make sense anymore because we've evolved. Society has evolved, and these problems have changed, and the impacts are now different. So I think the next thing that we'll need to do, and we'll talk about this, we'll flesh out each of these. We got to start asking who and why. When I go to a police department and start looking around and digging, especially when I'm digging through policy, I ask one question over and over and over again: why? Why? Why do you do this? Why do we do that? Why is that important? I mean, we have to constantly be involved in asking ourselves why, if we ever hope to change anything. But with drug take back programs, we need to add another question: who? Because the who in this particular question is important. And it's not the what. Drug take back programs are a great idea, they're a necessary community service. But the who is different than law enforcement. And hopefully we'll build a case for that. And ultimately, we want to start turning problems into solutions. I don't want to get up here on a, well, not up here, I guess it's a linear thing because we're all in the same place, but I don't want to get on this little computer thing and just complain and give you problems and tell you, oh, this is terrible. We want to start turning these problems into solutions. And we want to give you some resources and some tools to start turning this particular problem for evidence custodians into a real and meaningful solution for you and your agency so that we can focus on other things because there are a lot of other things that we could be spending our time on. So, all right. So, I was just reading the notes in case I wasn't doing something weird. Yeah, and I mean, I'm just reading through a couple of these. Uh, yeah, not a fan. Yeah, mine usually has needles in it. And Tim, you are not alone. In everybody's drug take back box, there are usually needles. There are usually diapers. There are usually fentanyl patches half used. There are all kinds of bad things in these boxes. So you're not alone. And that is one of the great reasons for not doing this anymore. But as we build a case, I do want to just take a minute as we kind of challenge the way things have always been done. Let's do a short history of drug take back programs and law enforcement and why they ever existed in the first place. Because, like a lot of things in law enforcement, there was a real problem at some point. Um, and law enforcement stepped in to help create a solution. Years and years ago, um, and I don't know how many years, just a bunch, but years ago, if and I don't want to be crass, and if you've just lost an elderly family member, I'm not trying to be insulting or hurtful, but let's say grandma dies and grandma has been sick for a long time and you're cleaning through grandma's stuff. It could be grandpa, it could be an elderly uncle or aunt. Uh, it doesn't have to be elderly, but anyways, they got a bunch of drugs, prescription drugs, things they've been prescribed, controlled substances like hydrocodone and fentanyl patches and metformin, which I am now familiar with, sadly. But all these drugs, and we don't really know what to do with them, there was no place for them. So, what most people ended up doing was just dumping them in the trash or flushing them down the toilet or keeping them themselves. So, there are a lot of different things that happen with these, but most of them weren't great solutions. We don't want to put this stuff in landfills because these chemicals tend to leach out into water supplies. There's a really great reason for not putting bulk drugs into trash cans because they're all chemicals that have effects and they do things. So we don't want to do that. There was no other place. So law enforcement stepped in cooperation with the DEA at some point. Yeah, this is not a truly accurate history or a timely history, but at some point the DEA and law enforcement got together and they said, "Hey, let's figure out a solution for this." And at some point, way back in the history of this problem, DEA used to help us out, and we would package up all the drugs, and the DEA would take it, and they would fund burning it. Now that still happens in some places, but that's generally how it happened. There was a real problem that existed. Law enforcement stepped in to address it, which was great. No problem there. In our society, and this is going to be preachy, so you can just turn the volume down for a little bit, but when you think about it, when there are social problems, there are two kind of frontline industries that are charged with the responsibility for solving the problem. One is education, and the other is law enforcement. And honestly, neither of those are great places to solve these social problems. But we're frontline organizations. Schools deal with children, and all the children go to school. Law enforcement deals with the public. All the people are in the public. This is a bad example, but those two entities are charged with handling and addressing frontline social issues. Whether we like it or not, that's just what happens. But because that exists, that doesn't mean that that's a sufficient reason for continuing to do the things that we've always done. It's not good enough. So we got to kind of challenge the way we've always done it and start looking at different ways, different people, different things, better choices, better resources, because those things have evolved over time. We got to start asking ourselves questions like who and why. Ask yourself this question: are drug take back programs particularly problematic for evidence operations? I say yes. And I will build a case for you as to exactly why I think drug take back programs are particularly problematic for law enforcement, particularly. But more important than the why is who. Are we the right team for the job? Is there somebody else out there that is better equipped to do this work, which is important and needs to happen? Is there somebody else out there that is better at it than we are? Is there anyone capable of doing it better? So we need to start asking not just why do we need to stop, but who can do it? Who's better at it? Once we start looking at those kinds of questions, we can start establishing our case. Now, I'm going to give you 578 billion and 12 reasons why law enforcement should stop participating in drug take back programs. And I'm going to go through them by number. But reasons number 1 through 578 billion is all kind of lumped into one. There are 578 billion reasons why there are other people who ought to be doing this other than law enforcement. 578 billion is basically the gross profits of pharmaceutical retail chains last year alone. In 2021, when you group CVS and Walgreens and Target, I guess that's now CVS, Walmart, Costco, Sam's, those big top 7 pharmaceutical retail chains made $578 billion in profits last year alone. Now, we're not going to talk about is that all right? Is that bad? Is that good? That's a whole different issue and not for this show. But when you have $578 billion in profit to work with, you got some room to solve some problems. And they have resources that we don't have. Pharmacies, retail chains are uniquely equipped to do this job. And that's reason 578 billion and one. In law enforcement, we don't have the resources that the private industry retail pharmacies have access to. They have access to shipping, they have access to marketing, they have access just training and knowledge with safely handling drugs. They have a first primary source spot where I mean if you buy drugs at a pharmacy, you're going to go to the pharmacy. It's not necessarily normal for people to go to a police department. Most people don't come visit a police department unless something terrible has happened. But a lot of us go to pharmacies every day. It's not, I mean, they're on every street corner. I mean, they're ubiquitous. They exist. So reason 578 billion and two is there are a lot of things in law enforcement that we don't do. It's okay for us not to do everything. There are reasons why people don't go to police departments to have open heart surgery because we're not good at it. We're not trained to do it. Is there a need for heart surgeons? Yes, there is an absolute need for heart surgeons. But are we the right person? Are we the right group? Are we the right team to perform heart surgery? No, we're not. We don't have the training, we don't have the knowledge, we don't have the experience. Same thing with drug take back programs. But the real big thing that I want to walk us through is how law enforcement drug take back programs pretty much violate every essential best practice or standard for evidence management. I think we can build our case there. So, reason number one, or 578 billion and one, is there are people that do it better. Retail pharmacy chains, all of them, with the exception, the possible single exception of Rite Aid pharmacies, every single one of them have a drug take back program of their own. Pharmacies do it better. Pharmacists, if you don't know, are well trained when it comes to drugs and knowing what drugs do and what they are. And how to package them up. I mean, that's what they do. That's in their wheelhouse. So they are already out there in existence, and they already do this work. They're already doing it. Every single one of them has a drug take back program of their own. It doesn't make sense for law enforcement to participate in drug take back programs when we don't do it as well. We don't have the same resources, and there are people that are better equipped, better trained, with better facilities and better access to resources than us. It just doesn't make sense for us to do it. It's not something that we need to own. Um, but I do want to walk through how these take back programs pretty much violate every single standard and practice for evidence management. And what I hope to do is allow you or help you kind of develop your own case to bring back to your agency to start a discussion for why these programs might be something to look at as far as discontinuing them. It's really important that we look at each individual problem and the impact that it has on an evidence vault and an evidence custodian to see why we need to stop these things and what we might do differently. So, just to take you through the list, and all of these are fleshed out in that little document at the bottom of the at the bottom of your control panel under handouts 1 through 5. It's take back the take back. But the first thing that I want to look at are just specific problems and how they impact us. Drug take back problems are problematic because the intake process for a drug take back program is absolutely the opposite of the intake process for an evidence vault. When we do intake, we know what's coming in, we know what's inside the package. We can make a determination by what the label says on the package as to what we can, how we treat that item and how we process it, how we handle it, whether or not it is safe for us or not, whether or not it's a health hazard, because we know what's inside the package. We are not in the business of taking things in if we don't know what they are. We don't allow that. We don't allow just miscellaneous or various or assorted things to come in. It violates the absolute basic premise of evidence documentation of what is this item? What does it tell us? Um, Drug take back programs are the opposite. You can stuff anything you want in those boxes. And I promise you, if you've ever looked at an evidence at a drug take back box, it's not just drugs in there. It's needles. It's adult diapers. It's garbage that someone has just thrown in there because it was a handy container. Then you move to chain of custody. There is zero chain of custody for anything inside that box. Zero. I mean, there is none. If I go to a drug take back box and I put 2,000 hydrocodone pills in there, no one's ever going to know. I mean, they just don't. There is no chain of custody. No one knows who brought it. No one knows who deposited it. No one knows exactly what it is. Those are all huge, huge violations of evidence practices and principles. When it comes to security, just the security levels that surround most of these containers are in lobbies. Uh, at the agency I retired from, our drug take back blocker before we discontinued it was in the jail lobby because that was the only area that was open 24/7. So everyone that gets arrested and released walks straight past the drug take back locker. And if they've been, you know, hurting for a little bit of hydrocodone, there's the grocery store right there. So the security that surrounds those is usually much less porous or much more porous than the security that we store our evidence in. Then just looking through safety. And one of the things that I'm trying, I don't want to go over each of these at length. What I want to do is direct you to this paper uh, because we build the case in the paper. I mean, there are safety and security issues associated with drug take back programs that violate what we ought to do as evidence custodians. And we'll spell out the case in there for both of those. There are huge safety features. I mean, the needles alone are enough to make me want to stop. But when you think about the different types of chemicals and different types of interactions of those chemicals that can be in those boxes, there are all kinds of health hazards. There are all kinds of physical hazards that could potentially be present in any of those boxes at any time, and there's no way of knowing what's inside. Um, it violates principles of drug storage. You know, we recommend in every training class that teaches anything about evidence management is going to teach you the same thing. We recommend storing drugs away from, separate from general evidence or property. And we recommend a little bit higher security for the drug storage areas that we store, and that's in a vault. So we recommend that you store drugs in a more secure environment inside of a vault, and drug take back programs put these boxes intentionally and knowingly in public spaces, in unsecure areas, sometimes covered with a camera, but who cares at that point? Just absolutely unsecure places. There's just not a lot of good uh, reasons for that. But as we go through the 578 billion and 12 reasons, some of my biggest, I guess, the reasons I feel most strongly about are the costs of doing this kind of work, especially when other people do it better. The amount of time that you spend as an evidence custodian on a drug take back program is time that you are not spending on actual evidence. It is time that you're not spending disposing of evidence, storing evidence appropriately, holding people accountable for packaging, performing audits and inventories and inspections. The time that you spend on drug take back programs takes away from time to do your actual job. And that's time that we don't have to waste. We have limited time, we have limited space. Drug take back programs take up both time and space, and that is a problem. There's an inherent risk of diversion associated with drug take back programs. I mean, if you got a box of drugs, let's say some of them are hydrocodone, a person with a substance abuse disorder or an addiction is going to go out of their way to obtain drugs. It doesn't make any sense. It seems insensitive and inhumane, actually, to provide a storage house for narcotics in an area that the public has access to, and then we expect no one to ever attempt to get in there and divert anything. It's bad business. Last two examples, and I know this sounds really preachy, and it might be. And let me take a look at the numbers. Most of you are still here, so that's good. Uh, are just unauthorized or mistaken disposition. Have you ever considered that someone might put a person's pharmaceuticals or their prescriptions, they might take them from them and then dump them just because they think they don't need access to them or they think they don't use them anymore? I mean, there's nothing that prevents anyone from putting anything in a box. So there's nothing that prevents the unauthorized or mistaken disposition of medications in a drug take back box. And there's no way to safely get it out. Now, this is an extreme example, and it might not be completely real world, but let's say you have some drugs, you put them all in a bag, and you want to get rid of them because you don't want them around the house, you don't want the kids getting a hold of them, but you accidentally put medication that you do need in there. You take it all, throw it in the box, and then you realize, oh crap, there's nothing beyond oh crap. There is no resolution for that because there is no chain of custody. You're throwing it into an open sewer essentially. You can't recover it. Um, there's no solution to that problem. We've created an unnecessary problem. And then there's liability. You know, as an agency, we have liability when we do things intentionally, when we create programs that have such fundamental flaws for us as law enforcement agencies, then we get to own that liability. And it's not just liability that we have to the public, it's liability that we have to an employee. If you have an employee injured or exposed to either a substance or a sharp um, as a result of their interaction with a drug take back program, your agency gets to own all that liability. It's theirs. Now, we don't use liability alone as a reason for not doing something. We should go back to the safety and security issue that undergirds that liability. We don't want to put our people in a position where they could be harmed in the course of doing a job that they don't really need to be doing. So I realize all of that is very preachy and very soapboxy, but I think it's an important question to start having at your agency. And one of the things that I would encourage you to do, regardless of whether you feel like this is an issue that you need to address now or not, download a copy of that white paper. Take back the takebacks. And if you have ideas or if you have the impulse to start asking these questions at your agency, we've laid everything out in fairly short order. It's a fairly short read, and hopefully that will begin to help you kind of build a blueprint for your own agency for having those discussions at your own agency. So I apologize for the preachiness and for the lack of volume at the beginning of the broadcast. But our goal is to bring solutions to you and help you create and generate solutions at your own agency that will be meaningful. I truly believe that if we eliminate things that take our attention, that take our time, that take our space, that take our resources, and divert them away from our core responsibilities, those are things that we could be, those are resources and time and space that we could spend elsewhere. It is a much better use of our resources to take those resources and direct them appropriately to the job that we know we have in front of us. So I'm going to go look and see if anybody has any questions. If you have any questions, I would be happy to answer them. We still have a few minutes, but we will certainly discuss it more. And if you don't happen to get your question in before we go, I'm always available at on by email. That's Sean or S. Henderson at evidencemanagement.com. There's Sean at evidencemanagement.com will work too. I know James has got one too, even though he's going to be on vacation and he won't respond. But hopefully it gives you something to think about. You know, at least something to think about. So, and to answer Rebecca's question, it was unrelated to today's topic. Oh wow, that's a good question. I do have suggestions, but I will send you an email, and I'm going to write myself a note so that I will, because I might not get to it today. But there are ways of doing that safely. Rebecca's question was, do you have any suggestions for taking in liquids like THC sodas? Uh, and that's a great and important question. Two things I would say. One, yes, I will email you. I will get back with you on that directly. But two, these are questions that would be great in the evidence management community forum because chances are other people have dealt with these issues as well. But I will give you my 2 cents for whatever that's worth and happy to discuss that with you. Um, and now that I've written it down, it'll actually get done. So thanks for joining us. Download the resources. If you join us late, catch us there. Um, and there is a way that you can view this later. So it is on our website. So I'm not sure when it'll get there. Probably by Friday. What day is today? Today's Thursday. Yeah, not by maybe by Friday. Depends. The guy that puts these on the internet, I don't know how to do it, but yeah, we'll definitely it'll be on our website and it'll be available as soon as it's kind of done processing. But thanks for joining us. If you're curious about 2023 training, give us a holler. Uh, have a great week. Thanks for being here. We'll see you on November the 10th, where we'll talk about something else. Yeah, that just means we don't have a topic yet. But if you have something you want to talk about, we're open. So thanks again. Have a great week. We got 2 more episodes left. We will announce our training schedule on November 10th. November 15th, we'll have our Christmas extravaganza. So join us on those 2 dates. Looking forward to it and hope to see you as well in 2023. I'm going to hit the little stop button right about now. So y'all have a great week and thanks for participating.